Why do you get high blood pressure? Modern medicine really doesn't know. It says that 90% of hypertension is essential, means we really don't know. But modern doctors know there are some risk factors for high blood pressure. One of them is age, as we've talked about. Another is overweight or obesity. Another, in some people, about half of people, is high salt intake. Another is lack of exercise. So those are clues about lifestyle. And a really big one is psychological stress, which activates the nervous system, can contribute to high blood pressure. So what can we do about this condition from a modern point of view? Well, there's the modern healthy diet, like the Mediterranean diet or the DASH diet, which means high in fruits and vegetables, high in vegetable sources of protein, nuts and legumes, whole grains, and then low in meats, salt, and alcohol. And that's very similar to many traditional medicine diets, like the healthy Ayurvedic diet. However, when you go to the doctor and have your high blood pressure discovered, very often or all too often, the doctor will prescribe for you a medication. Take this diuretic or this ACE inhibitor, as they're called, different medications. Now, those drugs may lower your blood pressure, but you know what? They don't cure your hypertension, because if you stop the drug, you still have high blood pressure. As a matter of fact, high blood pressure lasts a lifetime. It normally doesn't go away unless you do something more deeply about it. So that's one limitation of modern therapy. It doesn't cure the basic problem, doesn't cure the basic hypertension. There are also side effects. Every blood pressure medicine, as a matter of fact, every medicine used in modern medical care has some adverse or harmful side effects. And then, of course, there's the cost of modern medicines. And then there's this idea of one treatment suits all. This idea of different types of people and different types of therapies for different mind-body types is not really well known in modern medicine. However, in the system of Ayurveda, the world's oldest, most complete system of natural medicine, there are these two main ideas. One is that the cause of high blood pressure is ultimately due to a loss of connection with your body's own inner intelligence. It's that body's own know-how which creates balance and homeostasis. And when that is forgotten, when that gets off, then there's imbalance. In this case, imbalance in the mechanisms that regulate your blood pressure. So Ayurveda says, first we have to do something at that most basic level, at the causal level of high blood pressure. And second, Ayurveda realizes that there are three different major themes of high blood pressure. And those three different major themes go along with the three different major mind-body types: the Vata type, the Pitta type, and the Kapha type. Each of those can have a different flavor or different type of hypertension, from Vata, aggravation and anxiety, nervous system activity, from Kapha, overweight and fluid imbalance, or from the Pitta, more fiery, anger, inflammation type. In terms of using that knowledge for therapy, based on this, Ayurveda recommends a comprehensive mind-body environment approach to restore your own rebalancing mechanisms, to restore the body's own homeostatic functionings in the heart and cardiovascular system. From the level of body, Ayurveda recommends a healthy diet, a healthy lifestyle. A healthy diet for everyone would be high in fruits, vegetables, whole grains, low in meat and alcohol, and would be fresh, ideally organic, main meal at the middle of the day. And then there are dosha-specific or mind-body type specific diets. These you can find in more detail in my book, Total Heart Health. In terms of herbal supplements, there are a variety of traditional herbs which have been found to be useful in lowering blood pressure. VPK by Maharishi Ayurveda is one herbal supplement which is a combination of many herbs which helps to balance both Vata, Pitta, and Kapha types of hypertension. So it's one product that can be useful for many people. For more specific programs, you can see your doctor and work with your physician and Ayurvedic practitioner. But this is a general program that everyone can start out with for managing their mind, managing their body, and then creating a healthy environment to restore the proper functioning of your cardiovascular system and live long and happily.